Welcome to AM Best Audio.
As rising healthcare costs, mounting regulatory pressures, and growing demand for flexible benefit solutions continue to reshape the employee benefits landscape, insurers, brokers, and employers are navigating a rapidly evolving environment marked by medical inflation, increasing prescription drug costs, tighter underwriting conditions, and growing interest in alternative funding strategies, according to Amwins Benefits' inaugural State of the Market report. As benefit costs continue to climb, the industry is increasingly focused on balancing affordability, innovation, and long-term sustainability. I'm Lori Chortis for AM Best Audio, and joining us now to discuss that and other key insights from the report are Abby Caldwell, Senior Vice President and Health Actuary, and John Robinson, Vice President of Strategy, both within the Amwins Benefits Division. Abby and John, welcome. It's wonderful to speak with you both. Thank you so much for joining us.
Thank you for having us.
Yeah, thank you. We're looking forward to it.
As am I. John, we'll kick off today's discussion with you. What are the most significant cost drivers, claims trends, and market dynamics currently shaping the employee benefits and health insurance landscape today?
For sure. Thanks, Lori. So I would start with saying that this is not a new problem. As health insurance premiums and spending, they have been increasing for some time. But I can put some numbers to it, to the recent trends. And some of this was highlighted, as you mentioned, in our Amwins Benefits State of the Market report. So back in 1990, healthcare was about 12% of GDP in the United States. It's now 18%, and it's heading towards 21% by 2034. So more than $1 of every $5 that we spend will be related to healthcare. Family premiums, they reach roughly $27,000 this year, which is up 60% since 2015. So that said, the pressure is definitely building across the healthcare value chain. It's driven heavily by medical inflation, the rise in high-cost claims, as well as subsidy expiration. What's different in 2026 is that trend is accelerating. It's not stabilizing. And so PwC, just a couple of weeks ago, they recently published that the medical cost trend is expected to hit 9% in 2027. This would be the highest mark in about 17 years. And within that, prescription drugs, as you called out, are the single biggest driver. They're running around 11%. Specialty drugs, in particular, they're less than 2% of prescriptions, but nearly half of total drug spend. And then you layer GLP-1s on top of that, and some employers are adding 2% or more to their budgets for those alone. I would say nowhere is the pressure clearer than the small group and the stop-loss markets. If you look at ACA marketplace rates, they jumped sharply in 2026 and kind of in the high teen % range, with enhanced subsidy, with the enhanced premium subsidies expiring at the end of 2025, driving a lot of that. If you look at early marketplace rates that have been released by certain states for 2027, they're pointing to double-digit increases again. So this is clearly not just a one-year spike. On the self-funded side, where most employers actually sit, about 2/3 of U.S. workers are enrolled in self-funded plans. The story is both frequency and severity. So claims that used to come in under $100,000 now routinely top $250,000. Cancer alone is about 35% of our $1 million claims. And so that's severity, and as well as the frequency is really flowing straight into the hardening of the stop-loss market that we called out. And I mean, the industry premium has grown in double digits each year since 2022, and it's accelerating. It grew 13% in 2025 to $45 billion. And loss ratios are running near 90%, which is the highest in at least 9 years. So I'll conclude by saying, like, the market dynamic, it's putting pressure on the benefits landscape. You've got several carriers and reinsurers that support stop loss and small group that have actually decided to exit. And so you've got this rising frequency and severity meeting the tightening capacity. And that's the defining tension. It's costing claims are climbing faster than the market's appetite to absorb them. And as a result of these rising healthcare costs, you all are also seeing kind of the trends to alternate solutions as employers search for options and ways to manage the cost themselves.
John, you talked a bit earlier about rising prescription drug costs. How are those costs, along with rising medical costs, influencing insurers' underwriting, pricing, and plan design strategies?
Yeah, I'll start this one and then hand it over to Abby towards the end. But to begin, we're seeing carriers explicitly build higher trend assumptions into pricing to account for the volatility as well as the growing impact of high cost claims. There's a structural reason stop loss pricing in particular is rising even faster than medical trend, and this is what's called leverage trend. We did highlight an example in the report, and I'll lay it out here as well. When you have a fixed deductible and claims cost rise, the carrier's layer above that deductible grows disproportionately. So the example we provided, there was an 8.5% claim trend, and it translated into a 22% plus increase in the stop loss carrier's liability. So that dynamic kind of driven by the increased pressure on medical rates and the liability on the insurer is driving more conservative assumptions across the board. As a result of this, underwriting is becoming more selective. Carriers are leveraging tools like higher specific deductibles, lasers, and contractual changes to better manage risk exposure. And we saw that play out clearly this past 1/1 cycle, and kind of expect that to continue over the next couple of years. There was more declines, there was fewer early rate locks, and there was a much wider spread between the best and the worst risk. About 3/4 of our groups now carry a no new laser rate cap provision, and raising the specific deductible has become a deliberate strategy to get ahead of that leverage trend. So Abby, I don't know if you have some more to add on that.
Yeah, thanks, John. I would say on the plan design side, the focus has really shifted toward active cost containment. Things like site of care optimization, infusion management, and more strategic formulary management. And these aren't just kind of theoretical solutions. We saw for our particular group on our book that they saved roughly $485,000 in a single policy period just by moving the infusions that a patient was receiving out of the hospital setting. Similarly, dialysis management programs can cut up to 90% off of billed charges. We're also seeing growing attention on emerging categories, specifically in the RX space. So those GLP-1s, gene and cell therapies, and biologics, which really require a more deliberate balance between access and affordability. For an example, and we talk about this in the report as well, a single gene therapy can exceed $2 million a dose. And while claims this high are still extremely rare, we've seen a notable increase in gene and cell therapy claims on our own book over the past 3 years. And really what we're focused on is remembering that, for a small employer or even a small health plan, just one of those claims could be extremely detrimental. So overall, I would say pricing and plan design are becoming far more dynamic and data-driven than in prior cycles. And the carriers and plans doing this well are really the ones using their claims data to act earlier, managing risks before they hit, not pricing for it after the fact.
Customize your data experience. BestLink now offers an interactive company dashboard that provides company-level intelligence in a fast, user-friendly interface featuring interactive tables, charts, and Sparkline performance histories. Customize the dashboard tiles to prioritize the insurer ratings, data, and analytics that best support your workflow. AM Best. Our insight, your advantage.
Abby, with worsening risk pools, higher utilization, and significant losses driving above average rate increases, particularly for small groups, how are insurers responding? And how is Amwins Benefits helping clients manage these pressures and explore alternative coverage options?
Carriers are responding by tightening underwriting and raising rates. And as a result, this type of environment is really pushing employers to reconsider traditional fully insured arrangements. Amwins Benefits is able to help clients navigate those pressures by expanding access to alternative funding strategies and flexible plan designs, and advising on the most efficient and cost-effective contract and plan structures. The broader trend is that those fully insured employers are losing options and flexibility, while the self-funded and level-funded structures are gaining appeal precisely because they offer more control and transparency and data access. At Amwins, a big part of our role is helping our clients understand that full spectrum of alternatives. So from level funding, self-funding, to captives, PEOs, and even ICRAs, and what's really the best fit based on their individual risk tolerance and their long-term strategy. We're seeing level funding gain serious traction in some markets because, again, it offers small employers access to their claims data while still maintaining a level of cost predictability. Captive arrangements are another strong option for mid-sized groups wanting to pool risk and still control volatility, and really maybe a good bridge for groups that are looking to ultimately move to a true self-funded arrangement in the long term. And then for the self-funded groups already in the market, we're deploying cost containment solutions, such as those mentioned before, the dialysis management, infusion site of care optimization, gene cell therapy program, premature birth prevention. All of those types of programs can generate measurable and meaningful savings. Understand the risk that you're taking and build a strategy around it. Employers really need to think about administrator selection, network design, pharmacy management, and overall plan structure. And that's where our Amwins breadth of solutions and market access becomes a real differentiator. We're helping our clients balance cost, risk, and employee needs in a much more tailored way.
John, how are regulatory changes, transparency requirements, and broader healthcare policy developments influencing the employee benefits market today?
Yeah, so we're in a period of heightened regulatory focus, especially around prescription drug pricing and pharmacy benefit manager or PBM practices. Recent legislation, it's significantly expanding transparency requirements, giving plan sponsors far greater visibility into rebates, pricing structures, and PBM compensation. The direction of travel is toward true net cost pricing. And recent federal action, including a landmark FTC settlement in the PBM space, is reinforcing that shift. For plan sponsors, the practical upside is real visibility into where their pharmacy dollars actually go. At the same time, there's some broader policy developments, Medicare drug negotiations, changes to ACA subsidy structures, which we talked about in one of the earlier questions, and reductions in Medicaid and exchange spending that are influencing enrollment patterns and putting additional pressure on the commercial market. I'd say none of these are moving in isolation. As coverage shifts and healthier lives move between markets, that does tend to ripple back into the risk pools that employers and carriers are pricing against. From an employer standpoint, this is translating into a much stronger emphasis on fiduciary responsibility. There's increased scrutiny around how plans are structured, how vendors are selected, and how plan dollars are spent, particularly in light of recent ERISA-related litigation activity. Plan sponsors carry that fiduciary duty even when many of their vendors don't, and that's where a lot of the attention is going. And lastly, layer onto that the growing complexity of state-specific regulations, especially around leave and disability in the ancillary market, and it becomes clear that compliance is a core part of benefit strategy. The through line is that transparency and accountability are moving from compliance checkboxes to genuine financial and strategic variables. And because most of this is still being written and implemented, I'd say the direction is clearer than the magnitude, and we'll continue to see how that plays out.
Abby, with elective procedures returning post-COVID and contributing to rate volatility, how are insurers adjusting pricing and coverage strategies? And how will utilization, cost pressures, regulation, and workforce expectations shape the market's future?
Yeah, Lori, as we've touched on throughout this conversation, the factors driving this market aren't temporary. This is really the new normal, and groups that adapt will fare better than those just trying to wait it out. As utilization normalizes, insurers are pricing more cautiously, and they're emphasizing cost control. The future of the market will be shaped by continued cost pressure alongside rising expectations for more comprehensive and bespoke benefits. In response, insurers are taking a more segmented and disciplined approach to pricing and underwriting, leaning heavily into cost containment strategies, steerage, site of care optimization, claims oversight, and even early intervention. Looking ahead, the market will continue to be shaped by several converging forces: sustained medical and pharmacy inflation, the pipeline of these high-cost specialty therapies, expansion in the regulatory space, and even demographic shifts. At the same time, workforce expectations are evolving. Employees increasingly expect an integrated, tech-enabled experience and broader support across services related to mental health, women's health, and overall well-being. The future belongs to employers and brokers willing to treat benefits as a strategic investment, not just as a cost center, and to partners like Amwins Benefits who can bring the data, expertise, and solutions to navigate what comes next. The organizations that will be the most successful are those that can balance those competing demands, delivering affordability while continuing to evolve the benefits experience in a meaningful way while keeping the experience as seamless as possible for the end consumers.
Abby and John, this has been fascinating, so insightful, and it's been such a pleasure speaking with you both. Thank you so much for joining us today. I greatly appreciate it.
Thank you for having us.
Yeah, thank you. Thank you, Lori.
That was Abby Caldwell, Senior Vice President and Health Actuary, and John Robinson, Vice President of Strategy, both within the Amwins Benefits Division. For AM Best Audio, I'm Lori Chortis.
Looking to get the full attention of the insurance industry? We have the platforms that will do just that. Whether it be AM Best TV, AM Best Audio, Best Review Magazine, or Best Day. Find out more by calling AM Best Advertising Sales at 908-439-2200, extension 5399, and have a great day.